Our average PCR test positivity rate is about 20% as compared to 23% last week and 25.9% the week before. This is the third week in a row that we've seen dropping positivity rates, which means there's less viral transmission in Alberta. Our wastewater surveillance program is showing the same thing. The levels in most centers are declining or fluctuating at levels well below the BA1 peak. Wastewater data can fluctuate quite wildly from day to day due to factors in the virus as well as the wastewater stream at a given site. Some centers are showing a wide range of variation, but are continuing to trend down, like Lethbridge. Edmonton, Calgary, and Red Deer are all well past their recent peaks, but still showing significant amounts of virus circulating. But pressure on the system still is high, with the major hospitals in Edmonton and Calgary well over 90% occupancy and a few over 100%. Emergency departments and EMS are under strain, in particular due to high call volumes and delays in offloading. Delays that happen because some of the hospitals are full, particularly in their emergency departments, and Emerge just can't take the next patient as quickly as they would wish to. The pressure on the system is a reminder that we need to keep looking for ways to protect people and keep serious cases of COVID-19 out of our hospitals. And of course, vaccination remains the best and easiest way to avoid severe illness and outcomes. As I and Dr. Hinshaw have said many times, getting your booster doses is important to ensure a high level of protection against severe outcomes. That is why we encourage all Albertans to get every dose that you're eligible for.
Turning to today's update, between Tuesday, May 10th and Monday, May 16th, our PCR test positivity rate ranged from 17.5 to 22.5%, with an average of 19.9% for the week. As the Minister mentioned, the average number of people in hospital with COVID-19 has decreased from last week. Over the past week, there has been a daily average of around 1,190 people with COVID-19 in hospital, including around 39 in the ICU. Sadly, between May 10th and May 15th, that is last Tuesday to this Sunday, 55 deaths related to COVID-19 were reported to Alberta Health, which is an average of approximately 9 per day. Tomorrow, we will be reporting deaths over the previous week in total. It is important to remember that each of these numbers represents the loss of a person who leaves behind grieving family and friends. What we've seen in previous waves is that leading indicators, such as the number of new cases and lab positivity, are typically the first numbers to fall when the virus is on the wane. Changes in these early indicators are then followed by lagging indicators such as hospitalization numbers. Deaths are usually one of the last indicators to fall. This is why these high numbers of deaths that we have seen in the past weeks, as well as this week, is not unexpected, although it is a tragic reminder of the severe impacts of this virus. This is a late indicator showing the impact of the BA2 surge. As we're seeing positivity and hospitalizations begin to decline consistently, we should expect to see the same thing in the number of deaths very soon. Having said that, and as the Minister just referenced, we must remember that COVID will remain with us. We should expect it to return, especially when we get to colder months in the fall and the start of the season when we traditionally see a rise in respiratory viruses. Viruses like COVID-19 and influenza do still pose a serious risk to many people, which is why it's important to stay up to date on vaccinations and get all doses that you're eligible for. It's important to have as many layers of protection as possible to guard against severe outcomes, not only for ourselves, but for those who are most vulnerable among us. It's important to remember that vaccines, like any other intervention that we can offer either to prevent or treat an illness, are interventions that we have to think about how to use most effectively. And so when we're looking at the National Advisory Committee recommendations, where there was a strong recommendation to offer that second booster to all those age 80 and above, there was a discretionary recommendation about potentially going down to age 70. That was really based on the data that shows the impacts of the first series of 2 plus the first booster, so 3 doses for most people, remains protective against severe outcomes for the majority of people, and that second booster dose is most helpful in those who are at the oldest age range or who have other risk factors, such as those who live in continuing care. So we are continuing to look at the evidence and continuing to look at the National Advisory Committee guidance on what groups will benefit most from that additional dose, especially looking again at that risk of severe outcomes. It's important for people to remember that those who are younger, the third dose is still very effective at preventing severe outcomes. While we recognize that other provinces have lowered the age, we also know other partner provinces like British Columbia are watching those National Advisory Committee guidelines as we are. So really we're focused on scientific evidence and the populations that benefit most, which is where the advice has come from both our Alberta Advisory Committee and the National Advisory Committee. We know that there are many people in this circumstance who may have received either a single dose or a full series of AstraZeneca, and then may have received 1 or 2 doses of an mRNA vaccine last summer. So they would be beyond that 5 months from their 3rd or 4th dose, depending on, again, whether they received a full AstraZeneca series and then a full mRNA series. We have brought that specific question to our Alberta Advisory Committee to assess the need for offering additional doses to those individuals, since they have had what would be considered to be a booster dose in those circumstances. At this time, our Advisory Committee has recommended that we consider the final dose to be their booster dose. It is something that we continue to discuss with them and look at emerging evidence, just with respect to considering how long the protection against severe outcomes would last. So if anything changes on that front, we will, of course, let Albertans know. But at this time, we are following the recommendations of our Advisory Committee with respect to that specific population.